Welcome to this video series focusing on the care of school-age children and adolescents in primary care. Our hope is to promote a comprehensive and patient-centered approach in the medical home. Nationally, the rates of screening for psychosocial strengths and risks are low. We hope this video series will inspire new ideas about engaging youth and improving the health of this population.
I began my internship in the summer of 2012. I was 16 years old and I didn't know a lot about healthcare in the state of North Carolina. What I learned is that a lot of teenagers feel like they're not listened to by their doctors. And this survey is not just teenagers in North Carolina. It encapsulated basically across the states. And what we found was a common link is that teenagers do not feel like they're being listened to. When you look at the average teenager, most of them do look healthy on the surface. But when you look beyond the surface and you really look at a teenager, they're struggling with things that a lot of adults couldn't even, maybe not even handle. We live in a generation where it's very easy for people to make fun of other people. When you analyze these cases that you see on the TV and you see, oh my gosh, like how are people not noticing this? You have to take back and say, well, what if they went to their doctor and what if their doctor was able to talk to them about these heavy topics?
As physicians, oftentimes we have been hard-pressed to make changes into what we're doing and to acknowledge what some of the issues are out there. And oftentimes avoidance and denial is probably a way that we have in the past used dealing with issues. If we don't ask the question, then we don't get the answer and we don't have to worry about what's going on. And I've seen way too many times the excuse that there are no resources available, therefore I'm not going to ask the question. That's not adequate. Part of what we have to do right now is to identify where those gaps in services are, to identify where those needs are, and not at the expense of our patients, but let's push our system then to develop those resources and those supports.
Adolescents, just like young adults, need to be asked from time to time, how's your life going? How do you feel things are happening for you? And what makes you happy? What makes you sad?
Overall, I think you're doing really well. Your exam was normal, and it sounds like school's going well too. Is that right?
Yeah, I told you that I was going to work really hard to break that record, and I did, and it feels really good.
That's really fantastic. I'm really proud of you for doing that. I was also
and these are all questions that we each need to face at different stages in our life, and adolescents are no different. So let's start the conversation with adolescents sooner than later so that we can find out what's going on and we can challenge them to use their strengths.
A family physician or a pediatrician may not have all the answers, but and it is difficult when you are worried about not having the resources to get to somebody once there is a problem, but it's so important to start addressing that, because even if you don't have all the resources you need, you may have some that you need.
In some of the smaller communities, when there's an effort to identify who in the community has an interest in this, who's offering services for families around this, it's been really gratifying to see how folks have been able to identify, okay, here are some services that can still assist families, and here are ways we can get family to services. So I don't mean to minimize the resource issue, because it's definitely there, but there's more in communities than people often first identify.
Screening is just one of the tools that a physician has in their toolbox to look at the whole person. And in some cases it can point you in the right direction, and in other cases it may just open the door on more questions that need to be asked. But we need to be looking at those kinds of issues, and doing our best for patients means asking the questions and opening those doors.
And if we're going to sustain our healthcare system, we've got to lower cost and improve quality. And the way we're going to do that is by making sure we are catching things earlier, that we're screening for things earlier, and that we're preventing things, and when diseases are identified, that we're managing them better early on at the earliest level.
We've got to talk about it. And so we've got to have that conversation. We just can no longer deny it. We've got to get them to realize that this is important. This social emotional development for our adolescents is important. They are our future. They're going to be the citizens of tomorrow, and we've got to intervene now to help them be successful in the future.
These sorts of issues are really looking at people's health long term. Potentially you can impact the relationship of the people in the family for a long time to come, but we also have the potential of really having a positive impact on the health and the life choices that particularly these adolescents are going to be making as they move along. So to me, it's some of the most important work that you can do as a pediatrician, and also the most rewarding.